I'm Rosemary Gibson. I am the author of the book, The Wall of Silence, which puts a human face on the fact that we have medical mistakes happening regularly in healthcare. And the intent of that was to raise awareness and urgency and save people's lives and promote reform in hospitals. And I think we've had some success. I'm sure that people are alive today because of it. I went and found this Institute of Medicine report from the National Academy of Sciences that says we're harming people in great numbers, 98,000 people a year. And I said, gee, if we're going to fix that, we have to know who these people are and tell their story and tell how we can fix it. And that's exactly what I did, and that's how I got started. I'm a good generalist. I have a degree from Georgetown in liberal arts and policy and business, and then I have a master's degree from the London School of Economics. But I think it's important that we bring all these different backgrounds and disciplines to understanding healthcare. I worked at the Robert Wood Johnson Foundation for about 16 years and had the pleasure and privilege of coming into contact with many physicians, many leading physicians in this country, who were the first to put me on to these issues of quality and safety and harm to patients. And so I think it's important that we communicate this to the public. They have a right to know. There's a lot of good that happens in medical care every single day, and perhaps you and others have benefited from it. But the reality is that sometimes preventable harm occurs, and you need to be vigilant. You need to watch out for whether it's medication errors. So just last week I was in our public library and doing an event, and the librarian came up to me and she said, you know, I went to the drugstore last week, got my prescription, went home, took it, and she realized she got Viagra. If I had a chance to tell a person on the street what to do, realize that the medical care they get, a lot of it is just terrific and wonderful and will make your life better. But too often, it harms people, and you have to be aware of possible medical mistakes, whether it's a prescription you pick up at the drugstore or when you're going to have a procedure in the hospital. You have to be vigilant, watch everything, trust but verify. And then we have now an epidemic of overuse. People are having CAT scans and other types of diagnostic imaging that emit radiation. If you need a test, absolutely get it, but there's tremendous overuse. So be aware of your treatment options, the benefits and risks. Have a good conversation with your doctor and find out that information and be part of the decision. Hey, in my book, The Treatment Trap, I told the story of what overtreatment looks like. I tell the stories actually of many physicians. They're the ones who put me on to the fact of overuse because many patients don't realize if they're having a surgery that really is medically inappropriate. So some leading physicians in this country had back surgery, knee surgery when they were young or in some course of their life. And they actually are worse off rather than better off 40 years later. The consequences remain with them for a very long time to come. And so I want to communicate that to the public because they have a right to know. And this has sort of been secret inside what goes on in medicine. But now we have to open it up, let it see the light of day, so we can not just have people protect themselves, but also to have society sort of advocate for reform and say, this is not good, we need to stop it. And plus, we're breaking the bank financially as a country and as individuals. Sure, in The Treatment Trap, we talk about overuse of diagnostic imaging. There's a chapter called, Go Nuke Yourself. Full body scans when you're a perfectly well, healthy person, but just worried. That's not something that you want to do. There's very common surgeries that are overused: cardiac bypass surgery, angioplasty. Back surgery was named by Consumer Reports as the top overused surgery. So we give examples of top surgeries that are performed too often, and you need to watch out for that not happening to you. And then we give tips on what you can do, the questions you can ask, things to think about, how you just can't turn over your health and your decision-making to physicians and nurses because you know yourself best. In The Wall of Silence, we again give examples of common medical errors and tips of what you need to watch out for so you can prevent errors from happening to you, whether it's checking medications. If you have a loved one in the hospital, the truth is today you have to be there 24/7. Even in the middle of the night when a nurse's aide or a nurse comes in to give medication to your loved one, you have to know what that is. They're busy. Healthcare is under tremendous stress. So you have to play a very active role to make sure you get the care you get, the right care, not the care you shouldn't get. Healthcare is different from the care that our parents had and our grandparents. It's become a business. We have price bubbles in healthcare, very expensive. We have toxic assets, certain drugs out there that have been taken off the market, or certain devices because they've been defective. We have too big to fail, organizations that are very powerful, that it's really hard to hold them accountable. And we have privatized gains and socialized losses. That is, a lot of people making a lot of money, but we have a lot of harm. And so these are many of the same characteristics that America discovered was going on in the financial system. And because healthcare in our society has gone from a market economy to a market society, healthcare has picked up these characteristics. So remember, healthcare is a business, and you need to be a smart consumer and a smart patient. And when your loved one is there in the hospital, you need to advocate for them and to know what's really going on behind the scenes so you can get the care you need.